I am Bob Schrupp, physical therapist,
Brad Heineck, physical therapist.
and together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, I thought today we'd go over just one really good exercise to do after you've had a stroke. It's just a good one that it's fairly easy to do, but you are going to need a physio ball. You know, one of those.
Exercise.
Here, why don't you throw it to me? Not this ball.
So quit abusing it. Get away from it.
Throw it away. Let's get the right ball in here.
Throw it anywhere. Set it down over here.
All right, this is a physio ball. They come in different sizes, but we're not going to go over that. We're just going to go over.
Right. Yeah. A lot of people know what these are. You know, and if we're talking about strokes, this is usually people that their parents may have had a stroke. You might be 40 or 50 years old, and your parent may have suffered a stroke, and this is something you could help.
And there's actually a lot of exercises you can do on the ball with the stroke.
Right.
We'll have to maybe do some more in the future here.
But my point was, Bob, if you are 40, 50 years old,
you want to subscribe to us.
right? Because we're going to help with a lot of tips like this.
Yeah, we're going to help you keep healthy and fit, and if bad things happen to you, like a stroke, we're going to help you get through it.
Right.
Now, with a stroke, what happens generally is either an artery bursts or ruptures in the brain,
Right.
or an artery gets a blood clot. And either way,
Plugs up.
yeah, it actually causes death to part of your brain.
Because the blood flow to the tissues is no longer there, and without blood flow,
Right.
the tissue dies.
And the reason it's important for you to understand that is because what happens afterwards, because different parts of your brain provide different functions, like for example, quite often the middle cerebral artery is one that gets affected, and that often affects your arm, which becomes weak or completely flaccid, what we call it, has no strength at all. Or it might affect your leg. But there is recovery that can happen to that. The brain doesn't come alive again, but what happens is other parts of the brain can help out. Your brain is what they call plastic. It can actually over time...
Your brain might be plastic bag.
It means it's moldable, and then it can help out other parts of the brain. The other thing that can happen is that there may be swelling in the brain right after the stroke. And then as that goes down, your function is going to return.
Right.
So you're going to want to work your leg or arm, and this time we're going to talk about the leg. To indicate which leg we're talking about, we're going to pretend that this is the leg that was affected. And generally this leg is fine then.
Right, so, you know, if I was to walk on here, you know, if someone had a stroke, you know, you may see a gate like that possibly.
You may see like that, or it may not, you might fall right over.
Right, exactly.
So let's start. You're going to be laying down in position, Brad.
So this would be done probably with the person in bed, because you're not going to get them on a floor.
Exactly.
And you probably won't have an exercise table like this.
Right. Now, if you're alone and you have a little bit of ability, you could take this leg and hook it underneath that leg.
Like that?
Yep. And pull it up onto the ball.
Okay. Sometimes the leg may have a little bit of strength and it might be able to help, but you help out with the other leg.
Yep. And it might stay up there on its own.
Or,
if it doesn't, it's going to fall right off.
Right.
If it's going to fall right off, then you got to keep that leg. No, I would go underneath. I would keep that leg like that.
That's a good idea.
Yeah. Okay.
So I might even have to help with my arms to get it
or
up there.
When you put it up there in the first place, Brad,
Yep.
you can start in this position, bring it up there, and just leave it up there like that. Okay? So what you're going to work on here is basically just bending the leg toward you, and what you want to concentrate on, you want to visually watch it, because the more you give feedback to your body, the more the leg can respond. But what you want to try here is, as much as possible, have the involved leg do the work.
Sure.
You're trying to make this one do the work. If it can't help at all, then you're going to do it with the other leg. But eventually, what you should see is that this leg is helping, and it may take a couple days, it may take a couple of weeks, but you're going to see that this actually is giving assistance.
And if you're doing this with a friend or family member, you may have to actually help the first time, depending, just to help them get used to it. So there's nothing wrong. Like if Bob was helping me, he could grab my feet. And
I can even just roll the ball like this.
The ball just to get that.
Or if I was helping, I would take this one off, with this side, or maybe even off like that, and just start going like this.
Sure.
Great range of motion, and even say, okay, push, Brad, push. Okay.
And this is exactly what you'll see in the therapy room with therapists working with their patients.
So it's a great one just to start off and give you an introduction. We'll try to do some more in the future.
Yeah, and there's one thing, make sure the person has a pillow, because their neck gets sore.
Right.
Like this.
Yeah, this is not a good, comfortable position.
Can I go to the progression? So, with one person they can do it, then finally they can do it with the good leg helping, and after this leg starts to get stronger, then they would progress just to that leg.
That's right, exactly.
And, by that time, hopefully you're maybe doing some walking, put
Right.
some pressure through it. So I'm gonna take a nap here, Bob. You
All right,
say
sounds
goodbye
great.
to him.
Peace out.